When the blood stopped, the Secret Service didn't bring Maren Cole a commendation. They brought her a folding chair, a cup of lukewarm coffee nobody asked if she wanted, and a man in a gray suit who looked at her the way people look at a locked box they weren't expecting to find. "Where?" he said, setting a small digital recorder on the table between them. "Did you learn to do that?" Maren looked at the recorder, then at him, then at the coffee. She picked up the coffee. The Hargrove Children's Medical Center smelled the way all hospitals smell, antiseptic over something older, something that no amount of bleach ever quite reaches. Maren had worked the pediatric emergency wing for 3 years, and she had stopped noticing the smell sometime around month 4. What she noticed now, on a Tuesday morning in late October, was that the supply cart outside Bay 7 had a squeaky left wheel that facilities had failed to fix for the 6th week running, and that the attending on duty, Dr. Clement Ashby, was 40 minutes late. Again, Maren Cole was 29 years old. She had a face people forgot in crowds. Not unpleasant, just unremarkable, in the way of someone who had spent years practicing not being seen. Medium height. Brown hair pulled back with the kind of efficiency that had nothing to do with style. She wore her scrubs the way soldiers wear a uniform, functionally, without thought. The nurses on her floor called her Steady. Not a nickname, exactly. More of an observation. When the monitors went off, when a parent collapsed in the hallway, when a resident froze in the doorway of a trauma bay, not knowing what to do first, Maren Cole was already doing it. Nobody asked where she learned. They just assumed she was very good at her job. She was. But that wasn't the whole answer. The call came over the radio at 11:47 a.m., not the hospital radio. The city EMS channel that Maren kept open on her phone out of habit, a habit she had never fully explained to anyone, even herself. "Pediatric transport incoming," they said. 12-year-old male, gunshot wound, abdominal, unstable, ETA 6 minutes. What they didn't say, because the paramedics didn't know yet, was that the boy in the back of that ambulance was the son of a federal witness. That the shooting hadn't been random. That 2 people were already dead at the scene. That by the time the rig pulled into the bay and the doors swung open, there were 3 black SUVs parked at the far end of the hospital parking lot, engine running, that had nothing to do with hospital administration. Maren didn't know any of that either. She just heard the call and started moving. His name was Danny. That was all she got before the gurney came through the doors. One paramedic calling out vitals, another doing compressions on a bag valve mask, a third trying to hold a pressure dressing that was losing the argument with physics. BP 62 over palp, heart rate 140, GCS 12. He was talking in the rig, but he's fading. Bay 1, Maren said. Not a question. Dr. Ashby wasn't there. The second attending, Dr. Petra Van, was wrist-deep in a laceration repair in Bay 3. The senior resident, a third-year named Marcus who was excellent and knew it, took one look at Danny on the gurney and said, "Get Van." "Van can't scrub out," Maren said. She was already at the head of the gurney, already running her hands along the boy's neck, his jaw assessing airway while someone else called the OR and someone else pushed the crash cart to the corner of the room. "What do we have for the belly?" Entry wound left upper quadrant. No exit. Ultrasound in the rig showed free fluid. How much fluid? A lot. A lot. A lot. In a 12-year-old, a lot meant the clock was already running. It had probably been running for the full 22 minutes since the shooting, and it wasn't running in their favor. Marcus was good. He began the primary survey with the kind of focused efficiency that made Maren think he was going to be a fine doctor. He called for blood. He ordered the ultrasound. He did everything right, in the right order, and the boy's pressure kept dropping. 60, 58, 54. The OR was 4 floors up and 8 minutes away under normal circumstances, which these were not because the elevator bank was down to 1 car. Maintenance, naturally, on a Tuesday, and the stairwell door on the 2nd floor was being held open by a linen cart that nobody had moved. Marcus looked at the monitor, then at Maren. He's not going to make it to the OR. Maren was already thinking the same thing. She had been thinking it since the paramedic said a lot. "I need a Foley," she said. Marcus blinked. "What?" 14 French Foley catheter, and I need you to step back. There is a procedure. It has a long name, resuscitative endovascular balloon occlusion of the aorta, which gets shortened to REBOA in the field, Because nobody in a crisis has time for 5 syllables. That involves threading a catheter up through the femoral artery and inflating a balloon inside the aorta to reduce blood flow to the injury site and buy time. It is performed in trauma centers by vascular surgeons with imaging guidance and teams of people who train for it specifically. It is not performed in pediatric emergency bays by nurses. It is especially not improvised using a Foley catheter, which is designed for an entirely different purpose and is not, technically, medically, by any standard of practice, the correct device. Maren Cole knew all of this. She also knew 3 other things. She knew the anatomical landmarks by feel because she had learned them a long time ago in a place that didn't appear on her resume. She knew that the balloon on a Foley, when inflated in the right position, would do something close enough to what she needed. And she knew that without it, in the next 4 to 6 minutes, Danny, 12 years old, blood pressure falling like a stone, was going to die on the table in Bay 1. So she did it. The room went very quiet. Marcus didn't stop her. He didn't know what he was watching, exactly, but he recognized the quality of someone who knows precisely what their hands are doing. The scrub tech at the cart handed Maren what she asked for without comment. The monitor technician didn't speak. The sound in the room was the monitor. The bag. Maren's breathing, slow and even, the breathing of someone who has learned to keep their heart rate down when everything around them is going the other direction. She placed the catheter. She inflated the balloon. She waited. 61 seconds. The monitor changed. BP coming up, someone said. Quietly, like they were afraid to jinx it. 68/40. 72/44. Danny opened his eyes. He looked at the ceiling. Then, slowly at the woman standing over him, whose name he didn't know. Am I okay? He said. Maren looked at him. You're going to be okay, she said. We're going to take you upstairs now. You're going to be okay. She said it like she knew. She said it the way you say things when you've been in enough situations where the only thing standing between someone and the worst outcome is someone else's absolute certainty. He believed her. They had him in the elevator 4 minutes later. She was writing her notes at the small workstation outside Bay 2 when the man in the gray suit appeared. He had come in through the ambulance bay, which meant someone had let him in, which meant his credentials had cleared security faster than was usual for a walk-in. He was somewhere between 50 and 60, with close-cropped silver hair and the particular stillness of a person accustomed to being the most dangerous person in any room, while looking like nobody in particular. He was accompanied by a woman Maren's age in a dark blazer who positioned herself near the hallway exit without being obvious about it. He held up a credential case. Gold badge. The kind that made the security guard at the desk sit up straighter. Secret Service, he said. I'm Agent Werner Holt. I'd like to speak with the nurse who treated the boy. The charge nurse pointed at Maren. Maren didn't look up from her notes. I'm on shift, she said. I understand. This won't take long. You can wait 20 minutes. I have 2 more patients. Holt looked at her. She continued typing. He looked at the charge nurse, who looked at the floor, who was clearly not going to involve herself in whatever this was. He waited 20 minutes. The room they used was an empty consultation suite off the main corridor, the one with the broken blinds that facilities had also failed to fix. So the slats hung at an angle that let in a strip of pale October light across the table. Holt sat across from her. The woman in the blazer stood near the door. He placed the recorder on the table. He asked his question. Maren picked up the coffee. She held it for a moment. Then she set it back down. The boy is stable, she said. It wasn't an answer. I know. We've been briefed on his condition. Holt folded his hands on the table. Ms. Cole, what you did in that trauma bay isn't a standard nursing procedure. It isn't a standard procedure for most physicians either. I've spoken with the OR team that received the patient. They use the word extraordinary. They're generous. They're accurate. He tilted his head slightly. A modified Reboa, improvised with a urinary catheter, in a pediatric patient, in a facility without the imaging equipment to confirm placement. That's not something you learn in a nursing program. Maren looked at the recorder. Is that a question? Where did you learn to do that? The strip of light from the broken blinds lay across the table between them. Maren looked at it. She had been waiting for this question, or some version of it, for 3 years. Longer than that, if she was honest. She had been waiting for it, the way you wait for something you've planned for, but hoped wouldn't come. The way you keep a bag packed under the bed, not because you expect to need it, but because the not expecting has its own kind of comfort. I learned it, she said. A long time ago, Maren Cole had not always been Maren Cole. That wasn't her name in the sense that she had fabricated it. She hadn't. And Holt's team would find her birth certificate and her high school records and her nursing license all perfectly in order. Because they were. Maren Cole was her name. It was just that for 4 years in the middle of her life, between the ages of 22 and 26, she had gone almost exclusively by her operational handle, and the name Maren Cole had lived in a folder in a filing system at a facility in Northern Virginia that almost nobody was cleared to access. She had been recruited out of her undergraduate biochemistry program by a woman named Dr. Fielding. Never a first name, just Dr. Fielding, who had approached her in the university library during finals week of her junior year and asked if she had ever considered work that was more applied than academic. Maren had thought she meant pharmaceutical research. She had been wrong. The program wasn't called anything interesting. It was a division of a joint task unit that itself had a name so bureaucratically opaque it told you nothing, which was the point. What Maren knew, in practical terms, was that she spent 14 months in training. Medical, tactical, linguistic, and in the specific arts of being invisible in a crowd, and memorable only when she chose to be. And then 3 years in the field, in places and circumstances that don't appear on any public record. She learned to suture in a tent, in a country she cannot name. She learned pressure management in conditions where imaging equipment was not an option, and second attempts were not a possibility. She learned to treat blast injuries and hemorrhagic shock, and a dozen variations of every scenario she later encountered in the pediatric R. Not because she was preparing for pediatric emergencies nursing, but because in the field, you were often the only person available, and the person in front of you was always someone's child. She left when she was 26, not dramatically. Not with a fight or a crisis or a falling out. She left because the thing she had discovered about herself, the thing Dr. Fielding had perhaps seen before she saw it herself, was that she was not built for the parts of the work that required her to move on from the people she helped. She was built for the fixing. The aftermath had always felt like a door closing on something that deserved to stay open. She got her nursing degree. She took a job. She learned, again, to be the unremarkable woman in the room. And then a 12-year-old boy came through the trauma bay doors, and her hands simply did what her hands knew to do. She told Holt none of this. What she told him was that she had done additional training in emergency medicine, that she had worked in high-acuity environments before her current position, that the procedure she'd improvised was based on principles that were documented in trauma literature, and that she had made a judgment call under time pressure. Holt listened. He did not write anything down. The recorder sat between them, its small red light steady. When she finished, he was quiet for a moment. "Miss Cole," he said, "the boy you saved today is named Daniel Kerrigan. His father, Raymond Kerrigan, is the primary witness in a federal prosecution that goes to trial in 9 days. The people who shot Daniel today were not random. They were sending a message." He paused. "Raymond Kerrigan has a second child, a daughter, 7 years old. She is currently in protective custody, but the team covering her is down 2 agents due to circumstances I'm not at liberty to share." Maren looked at him. "I'm not asking about your past," Holt said. "I'm asking about right now. That's not the same question you led with." "No," he said, "it isn't." The strip of light moved slightly as a cloud passed outside. The broken blinds shifted. Maren thought about Danny Kerrigan asking if he was okay. She thought about the way he had looked at the ceiling. That specific look of someone coming back from somewhere very far away, blinking into the light of a world that had almost let them go. She thought about a 7-year-old girl in protective custody with a 2-agent gap in her security detail. "What do you need?" Maren said. Holt unfolded his hands. "Someone who doesn't look like someone." "That," Maren said, "I can do." The girl's name was Lily Kerrigan. She had dark brown hair and her father's chin, and a paperback copy of a book. about a girl who befriends a wild horse that she had apparently refused to leave home without. She was being held at a residence in a quiet part of Northern Virginia, the kind of neighborhood where the houses had mature oaks in the front yards and neighbors who went to bed at 9 and didn't ask questions. Maren arrived at 6:30 in the evening, still in her scrubs because there hadn't been time to go home. The two remaining agents were a man named Bosch, who was large and methodical and visibly exhausted, and a woman named Torres, who was lean and watchful and pretended not to study Maren when Maren walked in. Torres studied her anyway. Maren let her. "She won't eat," Torres said. "She knows something is wrong. We haven't told her about her brother. We're waiting for the father to make that call. But she knows." "Kids always know," Maren said. She went into the room where Lily Kerrigan was sitting on a twin bed with the horse book open in her lap, not reading it. The girl looked up. Maren sat down on the floor, cross-legged, which put her below the girl's eye level. This was deliberate. "That a good book?" Maren said. Lily looked at her. "You're a nurse." "How can you tell? You still have the crease on your forehead from where your mask was." Maren touched her forehead. She did. "Observant," she said. Lily shrugged. It was the shrug of a 7-year-old who had learned that being observant wasn't always a compliment. "Is Danny okay?" Maren looked at her. The girl's eyes were dark and very steady. The kind of steady that shouldn't belong to a 7-year-old but sometimes did, in children who had spent too much time in waiting rooms. "He's going to be okay," Maren said. "He's resting." It was true. It was also everything she was permitted to say. She said it the way she'd said it to Danny. Like a fact, like a fixed point, like the kind of statement that holds the room together just by existing. Lily looked at her for a long moment. Then she moved over on the bed, making space. "You can sit up here if you want," she said. "The floor is probably cold." Maren stayed through the night, not because Holt had asked her to. He had asked her to be present for the handoff with the additional agents arriving in the morning to consult on a medical element of the security plan that she had flagged as underprepared. The residents had no oxygen on site, no crash kit, no protocol for a medical emergency beyond calling 911, which in their specific situation carried risks she'd outlined to Torres in about 45 seconds. She stayed because Lily Kerrigan fell asleep around 9, with the horse book still open across her chest, and something about the sight of it. The girl's hand still resting on the page, not quite yet letting go even in sleep, made it difficult to leave. Bosch took the 3 a.m. rotation without being asked. Torres found Maren in the kitchen at 4, making the kind of bad coffee that comes from not measuring anything, and sat down across from her. "Holt said you were a nurse," Torres said. "I am a nurse," he said. "You saved the Kerrigan boy with a catheter, among other things." Torres wrapped her hands around her own mug. "Where do you actually come from?" Maren looked at the coffee. "Long story. We've got a few hours." Outside, the mature oaks in the front yard were losing their leaves in the dark, one at a time, the way things shed what they don't need anymore in order to survive the winter. Maren drank her coffee. She told Torres enough. Not everything. She would never tell anyone everything. Some of it wasn't hers to tell, and some of it still lived in folders in facilities with the kind of clearance that makes conference rooms go quiet. But enough. She told her about the biochemistry program and the woman named Dr. Fielding. She told her about the tent in the country she couldn't name, and the 14 months of training, and the 3 years in the field, and the specific discovery she had made about herself. That she was built for the fixing and not for the closing of doors. Torres listened without interrupting, which Maren appreciated. When she finished, Torres was quiet. "So you came back," she said finally. "I came back. To pediatric R nursing. Kids are honest," Maren said. "They tell you exactly how bad it hurts. They don't try to look tougher than they are." She paused. "I find that easier, actually, than the other kind of work." Torres nodded. Something shifted in her expression. Not softening exactly, more like recognition. The look of someone finding a word they'd been searching for. "Holt's going to come back around," Torres said. "Not tonight. But he's going to come back around. I know. What are you going to tell him?" Maren considered this. Through the kitchen window, the sky was beginning to lighten at its eastern edge. Not sunrise yet, just the idea of it. the first pale suggestion that the dark was temporary. "I'll tell him the same thing I told him before," Maren said. "That I learned it a long time ago, and that I don't do that work anymore." She paused. "And then I'll let him decide what to do with that." Tors looked at her. "And if he pushes?" Maren picked up her mug. "He can push," she said, "but I'm going back to work tomorrow. I've got a kid in the ICU who doesn't have anybody sitting with him, and that bothers me more than whatever Werner Holt wants to decide about my file." Tors almost smiled. Danny Kerrigan. Danny Kerrigan. The trial of Raymond Kerrigan began 9 days later on a Thursday, with the kind of gray November sky that makes federal courthouses look even more federal. Raymond Kerrigan took the stand and said the things he had survived, 2 credible attempts on his family to say, and the jury listened with the expression of people who have had the comfortable parts of their understanding of the world quietly rearranged. The prosecution won. Daniel Kerrigan was discharged from Hargrove Children's Medical Center 12 days after he arrived. He was pale and thinner than he'd been, with a healing incision across his abdomen that the surgeon told him would fade, but wouldn't disappear entirely, which Daniel seemed to find acceptable. He didn't know the nurse's name. He'd been told it afterward, but names are strange things after trauma. They slide off, won't stick. What he remembered was her hands. The way she'd been so entirely calm. The way she'd said, "You're going to be okay," like it was a statement of fact and not a prayer. He asked about her before he left. The charge nurse pointed him toward the workstation outside Bay 2, where Maren Cole was writing her notes with the same quiet efficiency she brought to everything. Daniel stood there for a moment. He was 12 and tall for 12 and suddenly uncertain in the way of someone who has rehearsed a thing and then forgotten it in the actual moment. "Hey," he said. Maren looked up. "Hey," she said. He didn't have the speech. It was gone. He stood there with his hands at his sides and his father a few feet behind him, and Lily beside him holding the horsebook. She'd brought it to the hospital, apparently, which said something. "Thank you," he said. It came out smaller than he meant it to. Maren looked at him. She looked at the scar below his shirt hem that she couldn't see but knew was there. She looked at Lily, who was watching her with those dark, steady eyes. "You did the hard part," Maren said. "You stayed." Daniel opened his mouth, closed it. His father put a hand on his shoulder. Maren turned back to her notes. The supply cart outside Bay 7 squeaked past, still not fixed, the left wheel still complaining every rotation. Somewhere down the hall, a monitor chimed. A phone rang. The smell of antiseptic and old coffee hung in the air. Maren Cole picked up her pen. She went back to work.